We continue to talk about itis family, bursitis, tendinitis, arthritis, and the most effective area in the human body. We're gonna move from the top to the bottom, and a lot of effective inflammation. Part of body. It's OA joint. It's right at the top of the bone, right here, in your base of your skull. Why? Sometimes it's not movable. We have some injury, or we sit a lot in computer. So those joints sometimes stuck and create a chronic pain because you try to move through this limited range of motion, and that's created a lot of inflammation in this area. So people start feeling headache. So focus, like do self-massage, grab it, or go to a massage therapist. Of course, they can release that area and mobilize your occipital area. Move down, of course, it's number one, it's a shoulder. All this tendinitis, bursitis, thoracic outlet syndrome, it's come right in here. Why? Because it's glenohumeral joints. It's most movable joints in our body, and it's a lot of problems up there because, like I said, we use our arms every day, all the time. So most problem is because, like I said before, we sit in the computer a lot, our shoulder hunch forward, and that's create this inflammation in here. So it's really important to go physical therapy or massage therapy, or do some self-care exercise if you feel any burning sensation or start like numbness, tingling. So it's the first symptoms you need to do some work done. A lot of stiffness, inflammation in your SI joints also, because sometimes we feel all this burning pain in here, and it's a hip, because it's also most movable joints, for some people not, and create a lot of inflammation. Also, it's attachment of the IT band. This is really strong muscle. There's a pull for this hip bone down, and sometimes you feel this inflammation of the bursa or tendinitis. So now we're gonna look at our life case study. We're gonna work on the shoulder today. What we can do for you to improve that shoulder pain or increase range of motion. So Kara, she's also have a shoulder pain, and we're gonna find out why she have this pain and maybe some increasing of range of motion. So Kara, how long has been discomfort in your shoulder?
Couple weeks.
Couple of weeks. What exactly you done? So
I feel a pain up my neck, kind of goes into here and it goes down into my arms, sometimes the front and here, but I feel it right on the shoulder blade and right underneath the shoulder blade and like in the armpit.
Okay, so she feel in the armpit, here, in the front, and all the way down. So it's probably a problem in the neck and the arm. It's a combination of all together. Something going on here, definitely. So we're gonna take a look posturally, and what I'm gonna do, I'll just step in the front and look at the level of the shoulders, and I'm already see this shoulder is kind of a little dropped. If you guys see it, and also it's a lot of rotation in that shoulder. Can you go ahead and side positioning? Look at this head forward, and see that rotation in the shoulder. So packs the arms, so we can see those palms up. Usually it has to be like probably like that, yeah. So the packs is tight, and of course we're going to check range of motion now. So go ahead, and it's a simple test. You're going to step back, turn back, feet together, and what you're going to ask the client, just go ahead and touch the scapula, and it's really, try to do it again. And you see how winning this scapula right here. So we have a decreasing range of motion for sure. And go ahead and do top, through the top through your hair, and touch that one. How's it feel?
Fine, it's tight.
Feel fine, just tight?
I feel tight in the pec.
So it should feel tight in the pec already, okay? This is the number one victim, right?
Perpetrator.
Exactly. So let's turn back, face this direction. Yeah, and go ahead and we're gonna figure out if you have any sprain or strain. Go ahead and raise your hand up. And what I'm gonna do, go ahead and push it up. Push it up. Do you feel any pain? It's a little bit weak. Like I'll go ahead and push down. Do you feel any pain this way? Okay, and go ahead and try to do full range of motion. Let's see if anything painful.
Just feel a little tension
Yeah,
here.
so feel she all the way up. You feel up there?
A little bit as I'm coming down.
Okay, you feel coming down.
A little bit, but it just cracked a little
Okay.
bit when I went up. I feel a little less painful.
go ahead, do side positioning, and go ahead, push down. Do you feel any pain this way?
No, just tension up here.
Just tension. So she feel a little tension. Go ahead and push down and push up. Yeah. Is that different when you?
Different when I push down. I feel it up here a lot.
Okay. I'm sure if you feel it up there. Go ahead and push inside. Do you feel any pain?
Not pain, just tension in the back here.
So she already start feeling. It's possible a little like a sprain. She don't know about it.
It's not painful. I just feel like a
Tension.
tight.
Okay. And the last test. So you're gonna do by yourself. We're gonna see the rotation. See if you can go and all the way down. Try to go all the way down. Yeah. You see what's going on here? The shoulders go forward. So we do have a problem with what's the internal rotation.
I can go like that.
Yeah, you see this is still pumping up here. It's not supposed to be this way. Go ahead and lay down face up. We can do the simple test on the table.
I feel a lot right now.
Yeah, and go ahead try to lower down. This is how far we can go. And go ahead and go all the way down. Yeah, so I believe she have like a little bit shoulder forward. That socket is go forward. That's what she have limited to go forward. Okay, what I'm gonna do right now, of course, I'd like to work on the pecs, and this is where we're gonna start with the pecs. What I'm gonna ask you to do radial motion, so try to rotate the whole shoulder in and all shoulder out. Okay, very gently and slow, don't rush. And I'm gonna apply the pressure. If you feel this pressure too much, you let me know. So I'm trying to like go a little bit deep and out, so lateral to medial. Go ahead, and 120 degrees. If a person can go 120 degrees, well.
Like, yeah.
Yeah, we can do the sandwich. I call this sandwich treatment. Yes, panini. I call panini.
Panini.
Because she's Italian, that's why she think about panini. So how's it feel?
I feel it more when you pull out.
So what I'm doing, I squeeze that pack and kind of pull it out.
I sort of feel a bit back my neck when you pull it.
We can work on this inflammation as increasing radial motion and break adhesions around the joint capsule. So what we're doing basically, we just add this humeral bone in the socket of the glenohumeral joint and waiting for up to 90 seconds. And of course, I'm definitely going to be working on the neck, subscap. Let me work on subscap if you can come over right here. So a lot of people come in and we start working on that area. They've like been shocking because no one touched it before. But yeah, this is a really important muscle up there, like subscapular, and it's really need to be worked. Very gentle because it's a lot of artery and nerves. That humeral bone, and it's gonna feel much looser. How do you feel for you, Kara?
It's looser.
It's feel great. It's looser.
The other muscles starting to want it to be palpated.
Yeah. So this is what we can do for your shoulder to get better with this inflammation and increase radial motion. A lot of people come with inflammation and pain in the OA joints. It's right in the base of your skull or sometimes in the neck. And it's a lot of inflammation in the neck area, the cervical area. This is what our massage therapist can do for you to improve this inflammation now. What I'm gonna do, I'm gonna grab the Kara head and I'm gonna push and compress on that spine really gently. I'm gonna hold it for probably like 90 seconds. I'm gonna do it, move a little bit left, very gently. If my clients complain on the pain, I will stop doing it. Find the tighter side, so we find out this towards the right side. I'm gonna kind of bend to the right and just hold it. It's gonna happen next 30 seconds or 60 seconds. Kara gonna start feel really warm in this area. How's it feel for you now? Do you feel any change temperature?
Maybe a little bit.
Not okay, not yet. So it's really gentle. I don't push so hard, and it's helped really release that tension. Don't wait for so long because this creates chronic pain. You don't want any chronic pain in your body. And let it go. How's it feel? And of course, I'm going to place my hands to release this tension in the occipital area and get this inflammation down. I believe massage, it's number one, can help you with your inflammation or any tendinitis or bursitis. We're at 15 minutes on Kara, and let's see how this should feel. Does you feel any difference when you radial motion and when your neck? Just try to look.
A lot less clicking in that.
And do you feel less tension?
Yeah, I feel a little bit like
lighter.
A little lighter on the side.
Yeah.
Mm-hmm.
So if you experience any discomfort in your shoulder, in your neck, all this burning or inflammation, give us a call. This is what we can do for you in 15 minutes. But if you book 1 hour, it's going to be more and more progressive and beneficial. Massage RX, that was inflammation information.
Stay tuned.
Stay tuned.